So as per the short, we will be talking about some neuroanatomy, about the corticospinal tracts and how it works. So this is the descending tracts for movement, also known as the pyramidal tracts. So where does it start? It starts from the precentral gyrus. Okay, so for example, area 4 on the Broadman's area. So that's where, our homunculus, the image of the homunculus is. So looking on that area, for example, where the thumb would be, so if you want to create a movement for the thumb, it would start in this area and it would go down into the internal capsule of the posterior limb of the corona radiata, okay, and it goes down through the medulla, the midbrain, basically the area of the midbrain, and that's why it's called pyramid, because it's formed, there's like a motor protuberance within the medulla, giving it the name pyramid due to its shape. And as it comes down, there's roughly 80 to 90% crossover, and because it's a distal muscle, the thumb, rather than a proximal muscle, it would certainly cross over. Okay, so it would be one of those 80 to 90% which would cross over. And then it would go to the spinal cord, where it forms a link with the neuron which supplies the muscle. So the top part, which is before it creates a link with the neuron, is upper motor neuron, whilst the lower part, which is a short part, would be the lower motor neuron, where it creates a link with the muscle. That neuron will be lower motor neuron. So hence upper motor neuron disease and lower motor neuron disease. Hope that makes sense. Thank you.